Hey everyone, welcome back to Static Cardiology here on EMTV. I'll be giving you an ECG rhythm and a scenario. On the bottom of the screen, you'll see a 1 minute and 30 second timer. This timer closely resembles the average amount of time you should be spending on an actual card during a National Registry exam. At the end of the card, I'll give you an answer as well as a treatment. Good luck.
3, 2, 1.
So this is one of my favorite static cardiology cards that I use for my students. As always, let's go ahead and first take a look at the rhythm to see if you got it right. To get this started, let's go ahead and get the rate here. So we'll go ahead and count the QRS complexes and find out exactly how fast this is going. So I've got 80 BPM. Now there are a couple unusual features to this actual rhythm strip. So let's go ahead and start by examining the waveform to see if we can identify it. Now, first thing you'll notice is a QRS complex. It's fairly wide. You're also noticing there's no real P wave here. Instead, there's a very artificial straight up and down waveform. If you're unfamiliar with these are actually pacer spikes. Because our QRS complex is wide, there's no P wave, and there's a pacer spike that immediately precedes a wide QRS complex, I would identify this rhythm as a paced ventricular rhythm. Nowadays, pacemakers are put in with dual chamber capabilities, so a lot of the times in contemporary pacemakers, you're going to see them pacing both the atria and the ventricles. In those cases, you see two pacer spikes, but the first pacer spike is immediately followed by a P wave. The second pacer spike is followed by that wide QRS. In this case, this might be an older pacer, or even this is what you would see if you were applying transcutaneous pacing in the field, but we know in the scenario this is likely an implanted device. So this is maybe an older pacer, or they just pace the ventricular pathways for whatever medical reason. So again, this is a paced ventricular rhythm. Let's go ahead and take a look at the scenario next. So we're going out for a 64-year-old male complaining of weakness and chest pain. Currently the patient is alert and oriented. Vital signs are as follows: blood pressure is 146/78, heart rate's 90, respiration's 17, SpO2 96 on Romer, and blood sugar's 126. A focused physical exam reveals clear and equal breath sounds and no extremity edema. For static cardiology, your treatment is based on whether you determine this patient to be stable or unstable. Now, unstable criteria, I use the acronym CHAD, and this of course stands for cardiac insufficiency, hypotension, alteration in mental status, and dyspnea. Based on the physical findings here listed in the scenario, there are no elements of CHAD that are met. So this patient, my final diagnosis for static cardiology would be a stable, paced ventricular rhythm. Let's move on now to the treatment. So this is why I love this card. And it's only because you're given this paced rhythm, the pacemaker's fully functional, there's nothing wrong electrically, and in the context of static cardiology, all you want to do, or all the student wants to do, is somehow find a way to treat this rhythm. But really the rhythm's fine. The pacemaker's functional, but your patient is complaining of chest pain. So really the lesson here is to act more like a clinician, to think like a clinician. So we're going to treat his underlying complaint, because electrically, physically, his heart is doing what it needs to do, his pacemaker's functioning. A-okay. There's no misbeat here, nothing like that. So treatment here is going to involve, just like always, the mantra, scene safe, BSI, IV O2 monitor. Next thing we're going to do is a 12 lead, and then we're going to treat this like an ACS pathway, so acute coronary syndrome. We're going to go ahead and give him aspirin, 324 milligrams PO. We're going to give him nitroglycerin, 0.4 milligrams sublingually, either as a tablet or a spray, 1 every 5 minutes with a maximum of 3 doses. We're going to consider giving him some morphine, 2 to 4 milligrams, or fentanyl, 50 mics, IV push. And then we can start some fluids, maybe hang them at TKO or KVO, and then rapid transport. That's all you need to say here. We don't need to do anything about that rhythm because it is perfect. And that's it. If you like this video, please make sure to subscribe to my channel for more static cardiology videos, as well as other videos that might be interesting to you. As always, please make your own playlists so you can practice your own static cardiology cards for your National Registry exams. Until I see you next, have a good rest of your night.